My job is so diverse. I get to interact with so many different people. I interact with administration. I interact with nursing leadership. I interact with bedside nurses, ancillary staff. And of course, the most important thing is patients. So I love it because I get to touch so many different lives in different ways. And I think taking care of people is the best thing I could do. I knew women's health was where I needed to be. And here I am 20 years later, not at the bedside any longer, but still working in women's health and still loving it today. We still rank more than 3 times higher than comparable countries for maternal morbidity and mortality. With that being said, we have to keep that focus on taking care of our patients and making sure that we're bringing health initiatives into that maternal population to reduce the risk of disparities. And we will continue to bring different initiatives into focus as long as we keep the core of our mission is to take care of our patients and to decrease any risk of maternal morbidity or mortality that we can here at St. Mary's.
I love the fact that the majority of what I do is happy and healthy people and deliver babies and perform different procedures that help patients later on in life. And the majority of the time, it's just a good outcome and everybody's happy with what happens and you get to take care of those people for years. There are aspects of health specific to women that they need more expertise and more training. And I'm glad to be a part of that because I think everybody deserves care, women, children, men. But if we can all, I can carve out my section to take care of women to the best of my ability, then I'll do it. Sometimes in obstetrics, things can be emergent. And there's been a couple cases, fortunately or unfortunately, I've been a part of in my career that have been emergent and had a good outcome. And to see those moms and kids graduating from high school and college, knowing that their start was a little rough, but you were a part of keeping them here and helping them lead a happy, healthy life is pretty fulfilling.
Educating my patients that I see in the office about their health and teaching them why things are happening a certain way. A lot of the times you can really see like a light bulb go off in their heads and they're like, this suddenly makes sense to me. This makes sense what's happening and why I'm having these symptoms. And it makes sense that I understand now why this recommended treatment will help me. And I think it makes patients feel empowered to make good choices for their health care. And I always love having those conversations with people and seeing that moment where everything just kind of falls into place and clicks for them.